Everyone, it's Dr. Charlie here, physical therapist. Hope you are doing well. I wanted to share with you a behind-the-scenes sort of coaching session that I had with a member of my private coaching program. And basically in this video, what you'll see is me coaching a woman I work with. Her name is Kelly, through her fear of sitting. So you'll see that she's been avoidant of sitting for some time. And look, it's totally normal. A lot of people with back, butt, and sciatica problems avoid sitting for fear of making things worse, right? Because maybe early on in their sort of injury or in their their experience of pain, it was something that really bothered them, right? But as you'll learn, avoidance makes sense in the early phase, right? But at some point, avoidance of that thing which you're fearful of actually keeps the pain and the fear alive. It can actually be the thing that keeps you from healing. So I'm going to coach her through that. And if you're struggling with sitting, you've been avoidant of it, right? If you are not sure how to break through it, and maybe it's not fear, maybe it's frustration or anxiety or worry about it, right? Or you're putting pressure on yourself to be able to sit, right, for a certain amount of time because you've got a trip coming up or something like that, then this video is for you. So in case you're new to my channel, my name is Dr. Charlie Johnson. I'm a physical therapist and orthopedic specialist, and I help people with back, butt, and sciatica problems heal naturally by teaching them to use movement as medicine, as well as shifting their internal sort of mental frameworks as it relates to trying to solve their problem. This is sort of a good example of that, again, as you'll learn, as you see me go through the coaching process. So look, if you'd like to learn natural ways you can solve this problem, such that you can avoid pills, shots, surgery, and or having to rely on someone else to fix you, then go ahead and hit the subscribe button as well as the bell for notifications when I go live with new content every single week. So let's get into it.
The only other thing that I really would like to start doing more is sitting, because I honestly, I'm afraid to sit. Okay. I don't want to sit. So if I don't have to sit, I don't, because to me, like, that's the one thing that actually hurt my back was just sitting. And so I don't want to re-injure it. And I don't know when, I'll feel like, I don't know, like if I'm going to know in my body, like, okay, now it's safe to sit.
Cool.
Yep. I don't know.
Yep. Got it. How long have you had this for now? It's been more than 6 months.
Oh yeah, no.
Wow.
The huge injury happened on November 7th. That's when I sneezed, and that's what sent me to the emergency room. But I had been dealing with my hip pain and everything for like a year.
Yeah. So let me just share something with you. This is a training. It's not in the portal yet, but like this is something I'm working on. I think would be useful for you. I'll just read through it and just kind of like see if anything strikes a chord, and then we can chat about it. Okay. Okay. This is the later part of the presentation, but there's this idea, right? At some point, okay, you have to start to change your perception of sitting, because you can't be scared for forever. Okay, right? All right, so I get it though. Look, you're totally normal, and that like a lot of people have this problem, especially as it relates to this back and nerve and hip stuff, okay? So I say this, and I'll just read this through, okay? Stop me if at any point, but I'll just read it through and we'll go through it. So I say sometimes, especially in case of chronic pain, greater than 6 months, which your hip is and some of the other stuff, right? We develop learned associations between certain activities or positions and pain. Our body could be completely healed physically, but our brains continue to feel threatened. In this case, we might find that changing our physical positions via tweaks previously described, so tweaks of the way I sit and doing this and doing that, right? They might be somewhat useful, and motion might seem like it helps at times, but we're still uncomfortable and like unable to get past it, basically. Okay, so I say this, think back to this pain fear cycle, okay, and let's apply it to your pain experience sitting. So it looks like this. Sitting hurts, kind of afraid to sit, so you sit less. Fear avoidance, right? Ooh, kind of now a little bit more afraid to sit because I haven't done it in a long time. So now there's a little bit more pain. There's a little bit more fuel every time you go through this, okay, in your brain. So this is an example. This is all unedited, so I don't even know if half of it makes sense, but we'll see. This is an example of a negative feedback loop that starts with discomfort and spirals into catastrophizing and getting caught up into in thoughts seated around what could be happening. Oh no, like I hope this isn't going to flare me up. Why can't I sit? This is so frustrating. This is really annoying. I kind of have to do this, blah, 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 blah. Or maybe you have like I don't know, like maybe you have to sit for work and you're like, I'm not going to go back to work until whatever. It could be related to anything, but the idea is there's some energy, some negative vibe around it. All right, cool. Okay, so now here it is. Okay, so I don't know if you can see this, but pain catastrophizing is basically worry, fear, anxiety, something like that, which is basically you just giving it energy and then right? There's some type of hypervigilance or focus on it and, avoidance strategy around it. And then it leads to you disuse, right? Disusing sitting or doing less sitting. It leads to some type of, maybe not depression, that's a strong word, but discouragement or something, right? Some emotion around that. And then you have this pain, and then it feeds this pain experience, and you can see the little angry dude with a couple hairs. Okay. And it just keeps going around. Okay. But you can see that there's another little kickoff to this, which is, hey, I don't really fear this thing. I can confront this thing like you would a fear of heights, and therefore I can get rid of it. I can recover and get better at it. Cool. Okay. So now how do we kind of do that? So when you're sitting, you begin to experience pain, one of two things can happen. You can either have a setback or a safe corrective experience. This is important, okay? So many people with back, butt, sciatica problems or hip problems, whatever, they limit their sitting or completely avoid it altogether. Now, if things are really flared up, if you're like a 90 out of 100, okay, which you're not at the moment, but if things were like maybe in the beginning, okay, if it's super sensitive and pain levels are high, then it's probably a good idea for now to avoid it. But in some cases, strictly avoiding activity, if it's too aggravating, right, can work. So it could work potentially, but now you're at the point, right? So here's the thing. If you avoid what you're afraid for too long, you'll never improve your tolerance of it. In fact, you'll keep the fear alive. So think of it like this. If you have a fear of heights, roller coasters, or whatever, how do you get over the fear? Do you avoid them altogether? Well, like you could, I guess, but no, avoidance might seem like a good idea and a safe bet in the beginning when fear levels are high. But as soon as you're confronted with the roller coaster or the height, all the feelings return. Fear, anxiety, worry, your heart rate, you get your dry mouth, your palms start going weird, right? It all comes rushing back because you haven't confronted the whatever you have around it, the negative association with it, okay? But you might be saying like, hey, well, maybe I'll get over the fear, just grow out of it over time. It'll just go away. Well, wishful thinking. But here's the problem. If you've got some form of fear, worry, anxiety, or frustration centered around sitting or your inability to do so, then avoiding it might be a thing that keeps you from getting over it. So now you might be thinking like Charlie, but sitting is like uncomfortable. Are you telling me to sit, suck it up, and just like work through it? Well, like I get it, and no, not necessarily, but I am asking you to confront it. Okay, your fear or your frustration or worry or whatever it is. Okay, so remember, pain is a danger signal. The way we react reinforces either a sense of danger or a sense of safety. So because we can control how we can react, we can either feed it with fear or soothe it with a sense of calmness. Okay, so every time we run from discomfort of sitting, we give our brain and body more evidence that sitting is dangerous, harmful, or bad, which is very unlikely to be the case. Okay, so fear fuels pain. Fear is what we feel when we think we're in danger. Pain triggers fear, blah, 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 and it makes it worse if we're not careful. So here's what I want you to try. So let's just say, okay, now you take this and apply it to whatever you want, but this is an example. Let's just say that you wake up, you feel pretty good, and you sit down and drink morning coffee or maybe work or do whatever you're doing with your kids or whatever. So bam, the pain starts to grow, okay? So immediately you're like, oh no, right? But become aware of it and any thoughts or stories that begin to pop up for you about it. Oh, here we go again. Oh, I wish this would go away. There's got to be something wrong. I know that disc. I remember that image. They said this was the problem. I can tell it's going to be a bad day because already I'm in pain. So whatever sensations and thoughts come, just recognize and catch them, okay? So that's the first step, is being mindful about it, all right? So mindfulness is the first step to breaking the pain fear cycle. Because if you can't see that things as they are and aren't even aware of the negative feedback loop that begins spinning out of control, you can't do anything about it, okay? So the negative feedback loop, the thoughts and feelings about sitting in your pain, is kind of like a ceiling fan. I say once it kind of gets going, it like whoomp, 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 and it just builds up, and then you're like, then you explode, right? Or you got to get up and you run away from it, right? So I'd say step two, once you've acknowledged it, there's this thing, oh, I'm kind of noticing this. Oh, I am saying weird stuff that I don't even know. I'm making up all these stories, right? Then you build evidence. So ask yourself, is there any good physical reason as to why this would begin? Did my image look different than it did 5 minutes ago when I wasn't sitting to now? Probably not. So is there any clear evidence of damage now compared to just a few moments ago? Is your leg all like swollen now? No. Okay. If the answer is no, you have at least some amount, or sufficient, I would call it, evidence to believe that there's nothing about sitting that causes real physical harm to your body. It might be sensitive, okay, but real physical harm. So step three, detach and surrender. So if we can agree that nothing about sitting is physically damage to your body, then realize the chances are high that discomfort you feel when sitting is simply a learned response. Instead of responding to, oh no, here it comes, I've got to get up, Attempt to operate from the understanding your body is in fact okay. Say to yourself, I'm okay. Jump out of the negative feedback loop, right, off the spinning fan blade and view it for what it is, a cloud of sensations that you can simply let pass. I'm not saying they will. I'm not saying they have to. I'm just saying view it like this for once. Okay, so here you are. Here's a little cloud. Now, again, it's really, I don't know. Can you tell what that says? Okay, it's a little hard. But there you are, right? And then like you're detached, right? You got this cloud. It's like, oh no, I'm starting to really kind of get into this thing, right? Like acknowledge it, right? Build evidence. Is there anything physical here? I mean, I feel it. Okay, so it seems like a physical thing, but could it just be a response? Because I don't really have any evidence that I just did anything. All I did was sit, right? So detach and surrender. Notice it for what it is. Okay. And what I say is, in other words, don't hyper focus. Let them fade like a cloud morphs and fades into the distance as it passes by. So look, the interesting thing about this practice is that once you build convincible evidence that sitting is not causing physical damage, you begin to realize that nothing is actually happening to you and you don't need to give it attention. Okay, now I know your brain might be saying, yeah, but, okay, hold on. Okay, so you begin to realize that nothing is actually happening. You don't need to be attention. You're free from symptoms when you don't buy into them anymore as being a problem, which means you no longer are worried about whether they go away or not because they're not a problem. It's just a sensation. My butt cheek hurts right now, but I'm not getting up because it's fine. I've just been sitting here for a while, for an hour talking, right? So think of it like this. We feel thousands of sensations every day. Right now, as I'm creating this lesson, I feel a texture of my jeans or whatever it is on the inside of my leg. My toes are cold. My shoulders are tense. Because I have no evidence that these sensations are threatening, I view them as normal. I'm not fighting them. I could care less about whether they stay or go away. Now, imagine that instead of being in my office, I felt the same sensation sitting in the middle of the woods working. My brain might build evidence that the rough rubbing sensation on my back of my leg was a big spider crawling up my leg. I begin to worry, catastrophize, and grow anxious about the sensation, stimulate a negative cascade of hyperfocus on my leg, building the energy behind the experience, I should say behind the experience, until, yikes, I scream out in pain or fear or both. So that's like the power of the brain, okay? So the point is, the more you can detach yourself, Kelly, from the negative feedback loop, okay, realize that nothing is per se broken, damaged, needs fixing at the moment. Now, maybe if you smash your finger with a hammer, I'm not asking you to just say you're okay. You're not. But if you've had something if everything else in your body is healed after 2 months, 3 months, and this is now a year, year and a half, you have to start to ask yourself, is something still broken? That's really weird. Maybe, but the chances are very, very slim. Okay, so the idea is you start to view things, your experience as a normal part of overcoming, right? The pain fear cycle. Realize you're going to go back into it, but if you can confront it from a place of safety, right, and you can do that over and over again, you can continue to increase the amount of time you sit.
Okay.
So that's kind of, that's kind of where I would go. Does anything about that kind of conversation resonate?
Yes. And I'm still afraid.
Good. That's good. Okay, look, you should still be afraid because you've been afraid for a while. So the other thing that maybe I'll add into this, right, conversation is this idea of outcome independence. If it doesn't work the first time, who cares? Do it again. If you fall off the first bike, is it like, oh my gosh, you tell your kid, see, you're never going to be able to do it. Right. Do it. Get on your bike again. It's fine. You're supposed to fall off. In fact, I'd be worried if you didn't fall off your bike, right? So the idea is that you're going to fall off. You're not going to ride the bike the first time. You're going to sit there and you're like, oh, Charlie, I'm really disappointed because I tried sitting and it didn't work as well as I wanted. Great. You're normal. Okay. Do it again. Right. And this time tune in and realize, oh, okay, shoot, I'm still afraid of this thing. Great. You're normal. It's unpleasant sensations. Okay. Is anything broken? No, it's not. Okay. Then get up and move around. Cool. I sat there for 10 minutes and I did longer than I did yesterday. Great. Okay. So now you don't need to time it, but hey, you got an opportunity to sit again. Why are you avoiding it? What are you so afraid of? Are your bones breaking when you're doing it? Is your disc bulging more? No. So do it. Oh, I don't know.
So for me, the problem is, the pain is really like, it was agony and it was horrible and it was just horrible. But I think the thing that also like stressed me out so much was like the numbness or tingling. That has remained, right? Like a doctor that I saw told me that may never resolve. So
it should go away with time. It should.
So that's still there. So I think back to when I was still like driving and doing all the sitting that I was doing before. And every time I sat, my leg would just fall asleep to the point where I could, my toes, I would have to, come back as quickly as I can and put my legs up into that wedge pillow.
Yeah.
And that would help. Or I would go and, lift myself up out of the, off the counter.
Yep.
To help with the decompression. So that would help. So I think that's, if I start experiencing that, and that can be in my head because I'm already like afraid, like I realize that.
Yeah, you don't actually know what's going to happen, but you're telling yourself.
Right.
Fair. Okay.
Yeah.
All right. Good.
So at that point, I don't even know if, I'm making this thing up, or if I'm really experiencing more tingling. I guess my question is like, because I was thinking I still have a little bit, faint achiness on my butt, just a little bit, nothing huge. So in my head, I was thinking, well, I need to be pain-free before I go back to being normal.
Don't wait that long, my friend. You're gonna be waiting forever.
Don't say that.
Yeah.
Oh,
Here's what I mean by it. You doing the work is going to get you there. You avoiding it is just going to be you avoiding it. The last 25% will come from you actually doing those things which you're afraid of doing.
Okay.
Right. So the progress will be in the doing, in the confrontation. Remember that little thing where I say, no fear, confrontation. You're going to have some fear. That's normal. Okay. But the more you can start to say, wow, I did that and it wasn't too bad. Right. So it's like, hey, do I have to completely get over my fear of roller coasters before I go on them? How are you going to do that? It's impossible. You can look at all the videos you want and you can think all you want. I'm not afraid. I'm not afraid. Guess what? You can be real freaking afraid when you're at the top of the roller coaster. Okay. So you don't go to the top of the roller coaster. You go on one of those baby ones where you're like, whoa. All right. And you're like, that wasn't too bad. Right. So you sit, right. And you sit in the discomfort for a little bit. No, at this point, you're probably not damaging anything. I'm not asking you to bring it to a 90 out of 100. I'm just saying, if you notice it a little bit, practice some of this idea of like, what things are popping up for me? Am I okay? Or is this something like that's something at this point, right after this month, that it makes sense that something is still truly damaged? Probably not. Okay. And so if I have stories coming up that are catastrophizing and building the worry or whatever, like that's normal. The problem is not the feelings. The problem is how you react to them. Oh gosh, I got to get out of here. And then what does that tell your body? That thing is really dangerous. Okay. So the idea is just to say, let me just sit in this thing. Yeah, I feel uncomfortable. You're going to. Okay. But is it causing any physical harm? Probably not. Take it to a point of tolerance, right? See if you can let it pass. If it doesn't go away, that's fine. Just try to have a safe experience compared to what you've had in the past with it, which is not having any experience right now because you've been avoiding it for so long. Just get in there. Just get to the edge of the cliff and look over for 5 seconds and walk away. You're going to feel like you want to throw up. Not if you look at the heights, you're going to feel like, you get what I'm saying? You're going to feel a little bit like anxious about it. But if you don't confront it at all and you wait forever until it's a 0, it's not going to get to a 0 because you've never confronted the fear of doing that thing. So that thing is not going to allow it to go away. The lack of confrontation of it. See what I'm saying?
So is this then at the point where I would start working out on the side that hurts, or no?
So I would just start confronting those things. You can we could if you want, and we can see if that's it. Like we could find tolerable things on the painful side to do. I guarantee it, right? But for you, what I would start to say is I'd say take those things which are in your brain as like, I don't know about this, and start to slowly do them. Not an hour of sitting. Don't do that. It's a bad idea. It's going to set you back. Okay.
Yeah.
10 minutes. You think you could do that? I don't know. You have to ask yourself.
Yeah.
If you think you could, then say, cool, I'm just going to do 10 minutes like once or twice a day. That's a major step from last week when you're doing nothing.
Yeah.
Hey, Kelly, are you still afraid of it? Heck yes, I'm still afraid of it. But guess what? You're doing a really good job. You're confronting it. You're not running away from it. So like, right, if you have like, if my daughter thinks there's like scary things in the closet, right, and she stays away from the closet all the time, Dad, whenever I'm not afraid of the closet, then I'll go over to the closet. You realize that like, that's here.
Yeah.
Okay. So what you need to do is I need to go over and I just say, look, closet, no monster. Oh, Daddy, I feel a little afraid. Great. You should. but nothing bad happened.
Mm-hmm.
No monsters came out and got you, right, Cam? Right, Daddy. Cool. Okay, guess what we're going to do tomorrow? We're going to do the same thing. And then guess what you're going to do in 2 weeks? You're going to go open the closet. Ooh, Dad, I don't know if I'm ready. Yeah, you're not ready for it right now because you're still scared. But if we open the closet every night and show you, and there's not a negative feedback every time you do that, a monster doesn't jump out, then you build more and more evidence the fact that it's okay and I don't have to be afraid of it.
Okay.
Kind of get it? I don't know if the monster.
No, yeah, I do. Yeah, I think it's just because, in my head it's like, okay, gotta take care of the hurts and don't poke it, don't pick at it, and avoid the pain triggers, and sitting has been one of the main pain triggers for me. So I just wanted to avoid it I guess.
Last thing, just to kind of like make this make sense, okay? And then I'll let you kind of like take this and run with it, all right? Because you're there, you're struggling with what everybody struggles with, but you'll get there. And it's cool because you're gonna go back to your old way of thinking about it. So that's why you can jump on a call or just be like post in the group, okay? So you see this, okay? This idea of like, look, when symptoms are high, okay, right? Your activity or function is fairly low. And guess what you're doing? You're avoiding stuff.
Right.
You have to do that in the early phase of healing. You like, there are people coming to the program, they're like, it just started yesterday, but like, I'm trying to no, it's too hot. You're going to have to really focus on, unfortunately for now, trying to avoid sitting for as much as you can, or getting a sit to stand desk, or like maybe not driving for a week. I'm sorry, but like, you can either be your own inflammatory pill or your own anti-inflammatory pill. And in the early phase, we've got to practice some type of avoidance. So there are avoidance strategies. This is shifting pain triggers. This is avoiding the sitting. This is modifying how you go up the stairs, or you sit, or you work out, or you bend, or whatever. Okay? Yes, are there more maybe intelligent ways to bend no matter where you are in life? Yeah, but I mean, it's not ideal for you to just avoid sitting forever. Okay? As symptoms start to come down, which they are, okay, at some point, we have to start to say, now we've got to start to expose and confront our pain experiences. And we need to challenge our body and our pain fear cycle, because if we just practice avoidance all the time, then the monsters are still in the closet. All right. So now you're at a point where you've shifted to the exposure point. If you ask me with where you're at, you've shifted to the exposure side of the equation, where you want to start bumping into some things. All right. Now, when I say bumping into things, right? Like, look, if you're like, how do I know if I should do this or that? Okay. If you had a green light, you wouldn't be in here. And these are activities that like cause you no pain. Just do those. That's fine. You're like, cool, can do that. Okay. If you're like doing stuff and you're like, I feel mild to maybe moderate, like a 2 to 4 or a 20 to a 40, right? But it calms afterwards, you're not damaging anything. You're bumping into something, but are you actually structurally damaging something? Probably not. All right. Now, look, if you're sitting, right, and it's like, you're sitting there in moderate to high pain, and it's like, oh, now I'm flared up for, like a couple days or something like that, right? And it's not getting better, like it's continued to flare up. So you had your little flare, but it's gotten a little bit better, right? So it's calming down again, okay? Then, yeah, you can't be doing that. It's too hot to handle right now, all right? So as long as you live here, right, in like this yellow light or this green light, right? Some symptoms at this point, maybe early on, you couldn't have tolerated doing stuff because your symptoms were too hot.
Yeah.
This is like people early on, why they come to me, because they're like, I was trying these nerve glides and I was trying this hamstring stretch. Yeah, it's not that those are bad per se. It's just that you timed it wrong, and whoever you were seeing probably timed it wrong because your symptoms were too high, and therefore the aggression of the treatment needed to be lower. Versus when the pain is lower, you can be a little bit more aggressive. You can expose yourself to things that are maybe a little bit more confrontational. So you're right. You might be able to, at this point, you might feel like you can start to do some things on the yucky side. And that would be okay, probably. You'd probably do okay. It's probably more of a yellow light versus up here was a red light in the early phase.
Okay.
Okay, so you kind of like, I try to graph this out to kind of like, just let people know, like, how does Charlie know when to phase or this or that? Like, there's a balance of the two, right? And at the end of the day, I think you're over here at this point. And I think sitting for you, as long as it's yellow light, and you can, I would start to try to break that pain fear cycle, challenge things a little bit more. And you're not doing it like all at once. Okay. So most people, they're just like, screw it. Charlie said I could just go back to dance. Like, Right. Well, no, I mean, like there's probably a more intelligent way, right? So like you start here and you say, hey, did I do okay? Cool. Now my brain says that's not that bad, right? And then the next time you go there and you do that a couple times, get a couple wins under your belt, right?
Yeah.
So on and so forth. So that's the idea. So that is how I would start applying things. Don't get overwhelmed by like, well, I could apply that to this and this and that. Pick like dance and sitting, and that's it.
Okay. I can do that.
Hold everything else constant. Your little press up thing, your one other little plank thing, and then you've got dance, and then you got sitting, and you're just applying this concept of kind of pain fear cycle, kind of like we talked about, catching it, detaching, sitting in it for a little bit. Am I okay? Getting out of it a little bit every day, right? Dance a little bit every day, and before you know it, right, you will build this thing up, and you will get to some goal.
That's very helpful. Yeah, this is very, very helpful.
Yeah. I thank you. It's not in it's almost done in trainings, but it's not there yet. So I'm behind on I have too many ideas to get out there. So this is what I'm revamping the program to have some of this stuff in it. Cause I think it's useful to see, like, it's just useful to hear this stuff.
Yeah.
So
and it's also very systemic, because it's so scary when you just think like, well, do anything. It's like, no, don't do anything or everything,
Yeah, you've got to start small. So there's probably an intelligent way to go about doing it. Chances are your body might be able to. So some people are like, you telling me your body might be able to do it. The problem is not your body. The problem is your brain. A lot of times, right? Like, because you'll psych yourself out before you even do it. You're already telling yourself that you can't sit before you even sat and it's been how long?
Since close to we started talking. That was in December.
Right. Okay.
That was like December 12 or something. I don't know. I sat for a little bit during Christmas Eve dinner and then New Year's Eve dinner.
Yeah.
That was it.
Yeah, I get it. So the idea, right, is like over time, right, your memory has started to fade, right? And like, you're like, I used to be able to sit, right? But like, what? And then, so that's what builds the frustration is like what you used to be able to do. It might have been months ago. And then even before that, it was even before that, right? So like your brain will say like, I should be able to do this, no problem. And then people just jump into it because they think like, oh, I should be ready. That's not the problem all the time. The problem is that you have to acclimate, right, your brain and your body back into doing things. And you just jump into that. And what's going to happen is your pain, you're going to spike your pain level too.
Yeah.
Right. So this will be flare up, right?
Yeah.
This will be like, hey, I'm bumping into things, but like, this is graded exposure. All right. This is slow and steady, like wins the race.
Yeah.
All right. So this is what I'd recommend to think about, along with the other kind of like stuff that we went through. And yeah, we've got to start to increase your tolerance for that stuff. I think you're on this side of the equation. Look, here's the thing. I'm not saying I'm right or I'm wrong. I'm just saying that I think based off what you've shown me that we can start to expose you to stuff. And worst cases, we have to go a little bit backwards first, build some stuff up, and then we can jump over here. But I'd start here sooner than later.
Yeah, I think I am because today, I tested today the left leg raise sitting down and I'm just stiff. So that yuckiness was just kind of like just normal stiffness that I also feel on my right leg, but it wasn't sending any shooting pain to my butt or to my thigh that wasn't happening. So it was all just like, oh, I can't really lift it much because overall I'm just kind of stiff.
Yep. Yeah, you're here, girl. Kelly, you're here. You just gotta start to work into it and give yourself permission to do it and realize that the feelings are normal. Don't try to get rid of fear. Just try to acknowledge it and just say, it's more how I'm going to react to it. It's normal that you're going to have that feeling. Okay. So that's not the problem. It's how you react to it. Try to detach, right? Try to become aware of it, catch things, right? And see if you can start to gradually expose yourself to it.
Okay.
Cool.
Thank you. Yeah. Very helpful.
Cool.